What are some common misconceptions everyday people have about nursing?
A lot of people think we fluff pillows.
That we get paid lots of money.
I think some people think that literally all we do is just wipe bums.
We don't. That's very little of our job, unless you work in gastro or colorectal surgery. But for the most part, there's not a lot of that.
So that we just feed people. I remember one of my brother's friends once was like, oh, do you have to go to university for that?
That we all sit at the desk, like the nurse's desk, and do nothing.
I've never caught anyone in a cupboard doing anything that they shouldn't do, like on the television. Never ever. In 34 years.
In the old generation, the guys are allowed to slap the nurse's bottom. Nowadays, it's called sexual harassment.
Whereas in reality, we're the ones that are with you all the time. You'll see the doctor for 5-10 minutes maybe, and they'll sort of walk in and we've already done your bloods, we've done the ECG, we've done all the tests that need to be done, and the doctor kind of walks in and diagnoses and does their little thing and then gives us orders to make you better.
I can definitely say that most of the time we're running around with barely any time for ourselves.
Another misconception is that we get paid really well, and some nurses do, but they may have been working for 10, 15, 20 years and have chosen a specific career path.
That we went into nursing because we were too stupid to be doctors.
I get told often like, oh, were you not smart enough to be a doctor? I think that's the worst insult I've had so far.
I get that question quite a bit from people.
And I'm like, no, like I've done 6 years of uni, like I've got a master's degree and I work in resus and you can ventilate people and do inotropes and all these fun, amazing things. And that's probably the biggest misconception, is that you don't have the clinical knowledge or you just weren't smart enough to be a doctor.
I think education levels of nurses, I think that's another misconception. People originally thought that we were probably not as educated and we weren't smart enough to, say, do med school or smart enough to do any other higher level position. That's changing now that people, especially with COVID, I think people are realising now that we actually have a lot more education behind us and we actually know a lot more than what people think.
I think a lot of people don't realise how much training actually goes into nursing and how much we're constantly upskilling and keeping up to date with knowledge. And a lot of people think that we just sort of go around and keep them comfortable and make cups of tea. And then when you actually explain to them like why we're doing particular things and why we're prioritising their medical care and how it's going to impact them, and then they kind of have a bit of a light bulb moment and they're like, oh, there's actually so much involved in it.
Something I hear from my mates a lot is the level of autonomy we kind of have. I'm talking probably specifically to the intensive care unit at the moment, but it's not all just wiping butts and sort of doing the groundwork. We're actually dealing with medications that if your infusion runs out, the patient's going to dump their blood pressure and they're going to be in pretty hot water pretty quickly. So your timing needs to be on board all the time. You need to really make sure that you are bringing your A game, to work.
So I think the misconception, the nurses are only females.
The way that it's evolved, even within the last 10 years, has seen gender equality within the career.
I used to have to respond to old patients, calling out, "Sister, sister!" And I'd have to, walk in the room and say something funny like, call me brother or whatever, it doesn't happen so much now, but certainly still working at the rural sort of critical care unit that I'm at now, probably the patient demographic out there isn't so used to male nurses.
A common misconception that I experienced was that guys can't be nurses, and I can tell you now they can be. There's heaps of us around. I think there's only 12.9% of nurses are men. You get looked at and you're like, the doctor's walked in. No.
I had an instance the other day where the patient, sort of addressed the doctor, who was female, like she was the nurse, and she was like, "Oh, I'm your doctor." And he goes, "Well, who's my nurse?" And I was like, "I'm your nurse." And he's just like, this guy's brain just exploded, It was pretty cool.
Misconceptions would revolve around TV shows such as Grey's Anatomy, where doctors seem to do most of the work, when I guess in reality they do a lot of the work, but the nurses do a lot of the groundwork around that, acting out their orders so that the patients can have the care?
I think the most common one, and I think it is slowly disappearing given, and I guess this is a positive of COVID, is it's made one of the misconceptions disappear, that we are the handmaids of the docs. I think it's, thanks to COVID now, it's kind of disappeared. I think everyone's now appreciated our role a lot more.
Another misconception that we just follow doctor's orders. That's a very outdated view. That's not the current situation where we're independent of medicine, but we are, like, you know, it's a side-by-side relationship, you know, like we need them as much as they need us. So it's working together rather than just being the handmaid to the medical staff.
That we are always nice and caring all the time. Sometimes we do get frustrated, but not necessarily with patients. We do get frustrated, we do get sad, and that we do bounce, but that sadness stays with us.
Hey, I'm Jackson, founder of The Nurse Break, a platform for nurses, midwives and students working in Australia.
And I'm Daniel Dellaway, founder of The Archive, a platform where I interview everyday people about their life stories.
We hope you enjoyed watching these videos as much as we did filming them.
And if you don't want to miss the next one, make sure to join our mailing list by clicking the link wherever it is.
And every time you share our video, we'll do a little dance. Off camera, obviously.
I'm not dancing.
Okay, I'll dance.
I'll dance a little bit.
I almost didn't know if it was appropriate to talk about.